With that, I am now going to take a moment and introduce our featured speaker today, who is becoming a close friend of mine. Tracy Brazg is the Director of Interprofessional Education at the University of Washington Center for Health Education, Interprofessional Education Research and Practice. It's a mouthful, Tracy. Tracy earned her bachelor's degree from McGill. So another connection to the NPPCE group in Montreal. And then she earned her joint MSW and MPH, as well as a master's in bioethics at UW. And then, as if that wasn't enough, she got a PhD in social welfare. So if you're counting, I think that's 16 degrees maybe. In addition to leading efforts at the University of Washington on interprofessional education curriculum development and community engagement, Tracy also works as a clinical bioethicist and is an affiliate instructor at the UW Bothell School of Nursing, where she teaches quality improvement and clinical ethics to nursing students. So we could not imagine a better person to be our inaugural guest speaker for NPPCE. So I'm going to stop sharing my screen and let Tracy take over.
Great, thank you. Thanks for having me. Such an honor to be here. I obviously had a circuitous path to where I am and did not need to do all of that graduate work, but nonetheless, I think it landed me exactly in this spot where I am here today to talk with you all a little bit about collaboration and interprofessional education. So first of all, when I was asked to do this, I thought there would be maybe like 6 people here, so I'm surprised and thrilled that there's such a great audience. I hope I can rise to the occasion and use this time in a way that's useful for you all. So the other thing is, when I was asked to speak to you about sort of, interprofessional education, best practices for interprofessional education, I think there's a lot of different ways that talk can go. I'm here today to tell you a little bit about what interprofessional education is and why we do it. But also that part might not be so interesting to some of you who maybe have your head around that concept. But I'm hoping that this idea of a T-shaped professional will be interesting to many of you, both as individual clinicians, as well as clinician educators, as well as just people in healthcare and in the world, to be able to think of ourselves as this idea of a T-shaped person or T-shaped professional. So that I'm going to give you a little bit of theory. I'm going to give you a little bit of definition, and I hope that you can take these back to your own groups, to your breakout groups, to your institutions, and kind of use the information. So I'm going to start with a little bit of a personal reflection, but not ask any of you to share because we don't have a lot of time and we're a pretty big group. But the reason I want to start with the personal reflection in just a minute is because I think that just as we're talking about interprofessional education and your roles in teaching interprofessional groups and teaching IPE kind of intentionally, I think reflection is such an important part of that, not only of interprofessional education, but also of interprofessional collaborative practice of us actually working together. So I just want to take a moment to get our heads into the practice of doing that. And then I'll just define what IPE is. Admittedly, I just added this slide while everyone was talking about 5 minutes ago. I realized that maybe not everybody knows what interprofessional education is. I'll talk about some of the challenges of collaboration and teamwork, and then I'm going to give this theory burst about this idea of a T-shaped professional. And then there won't be time for this, but in general, when I give this talk, I give some time for reflection and discussion for you all to think about some of the things I talk about and how you can incorporate what I spoke about and these ideas into your own practice as well as your own work as educators. So this is the reflection I want you to think about. Sorry, I need to move all of these people out of my way. This is the reflection that I want you to think about. It's not necessarily specifically about IPE, but I think this is a great question to ask yourselves. Think about a person for whom you have a great deal of respect, but who you don't always see eye to eye with. Okay, vision that person in your mind. When your approaches or perspectives diverge, how do you communicate with each other? So think for a moment about that. And what makes it possible for you to maintain respect for the person despite your differences? Okay. So as I go through some of what I'm about to talk about, a big part of what I'm about to talk about is how we meaningfully integrate and connect with people who might be coming from different places than us. And as I mentioned, this idea that I'll talk about in a few minutes of a T-shaped professional I think many of the skills that I'm going to talk about that are required to be able to link up with people are the same kinds of skills that we actually have and many times use in our own personal lives to sort of just deal with and work with and be in relationship with people who might not be just like us. So we actually often have the things we need to be great collaborators. We can just look outside of our professional interactions, our professional lives to see where those skills are and how we practice them all the time. Okay, so here's the slide I added. What is interprofessional education? In case anyone is not aware, IPE occurs, the World Health Organization says that this occurs when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. And the idea is that once students understand how to work interprofessionally, they're ready to enter the workplace as a member of a collaborative practice team, and that this is a step in moving health systems from fragmentation to a position of strength. And really, collaboration, as you all might intuit or maybe even just know, is good for everyone, really. It's good for patients, it's good for us as clinicians, and it's good for our healthcare systems. And I'll talk a little bit more about that in a moment. So this is an Institute of Medicine model that talks a little bit more about kind of how we do this thing called interprofessional education and what we hope will come from it. So this blue square here talks about how interprofessional education, even though the World Health Organization defines interprofessional education with the word student in it, actually the Institute of Medicine says that interprofessional education actually happens across the learning continuum, starting in the earliest days of our foundational training as healthcare professionals into our graduate or, post-foundational kind of post-licensure training, which would be residency, fellowship, et cetera, all the way into our continuing professional development as clinicians. And as you see this kind of, I don't know, bugle is the word that's coming to my mind, like those crackers, but this image, kind of this triangle, it gets bigger as we go across time. So while I spend a lot of my days thinking about training healthcare students about how to be good collaborators, that's actually probably the least amount of interaction and exposure to these ideas of collaboration that folks will get. Where you are out in continuing professional development or even here training trainees is actually where a large portion of this education happens, and it's important that it happens intentionally. One thing that I always say about interprofessional education, I should have added the slide about this, is that interprofessional education is not just butts in seats next to each other. It's not just standing in a group together and just being and sharing space. It's actually really intentional and integrative. And so there's a lot of work to be done here where you all are to ensure that the opportunities where folks have to learn with, from, and about each other are truly intentional and not just opportunities where everyone's standing around sharing space and maybe gleaning some things from each other, but not necessarily learning the most about how to actually be a team together. So some of the things that we hope to achieve with interprofessional education includes changing folks' reactions, their attitudes and perceptions, their knowledge and skills, their actual behavior and performance in practice. And as I mentioned before, this hopefully, if done well, if folks can learn to collaborate and work together well, this hopefully impacts our individuals' health, population and public health, as well as organizations and system efficiencies, cost effectiveness. And then the thing that's not on here that I think is really important is that effective collaboration, good collaborative teams result in higher staff satisfaction and lower burnout as well. So it's very good for not only individual health, but individual clinicians' well-being as well. And here in this green are some of the enabling or interfering factors, things that get in the way of these outcomes being achieved. A really big one is professional and institutional culture, also workforce policies and financing policies. And there actually are a lot of other enabling or interfering factors, but these are some of the big ones that the Institute of Medicine calls out. And I'm not watching chat, so Amy, if anyone's saying anything that needs to be shared, please do not worry about interrupting me.
Thanks, will do, Tracy. Mostly we're just reinforcing your learning points so far.
Great. I just wanted to take a minute. This is a little bit off topic maybe from what I just talked about, but I think this is really important. So language really matters when we're talking about collaboration. And this might seem a little armchairy to folks, but I think it's important for us to start as a culture and as clinicians to really use the right words. I think we try to use the right words always. And so when we're talking about collaboration, I think it's important to use the right words also. So there are 3 different words here: multidisciplinary, interdisciplinary, and transdisciplinary. And they all mean slightly different things. So the two words that I see getting confused the most often when we're talking about interprofessional or interdisciplinary collaboration are these first two, multidisciplinary and interdisciplinary. So multidisciplinary talks about professionals working in parallel or sequentially from disciplinary specific bases to address common problems. And I would say that up until recent years, healthcare has been largely multidisciplinary. And I think that now we're moving in this moment in the past, several decades of time, and especially in North America, we're moving towards this idea of practicing in a more interdisciplinary way, which, as I mentioned before, it's not just that I called it butts and seats, but I think it's this idea of just being in parallel with each other, that we don't think that that's the best anymore. We think actually that we can do better, that we can work jointly in a truly integrated way from disciplinary specific agendas to address common problems. And so I think this interdisciplinary place is where what I'm talking about today, I think it's where healthcare is going or has already gone. And I think it's where we need to be training the next generation of healthcare providers to actually make the shift from being a multidisciplinary practitioner to an interdisciplinary or interprofessional practitioner. And just one other thing about words, in interprofessional education, the folks from all of the different accrediting bodies who have come together to kind of name and define the characteristics of interprofessional education have decided in the last couple of decades to use interprofessional instead of interdisciplinary. I think that is up to you, which word you feel most comfortable with. The reason for that, though, is that in medicine, there are many disciplines. And so sometimes someone could use the word interdisciplinary and actually mean an interdisciplinary team of physicians. And so there was a movement to kind of, when we're really talking about different professions and collaborations and team, to use interprofessional. But I would say that really they mostly mean the same thing, especially if the interprofessional, multi-profession part is obvious in what you're talking about. And then there's this idea of transdisciplinarity, and this is even kind of newer, next generation. This is really a hot topic in academia and research. It's when professionals work jointly in an innovative and generative fashion, using a shared conceptual framework that draws together concepts, theories, and practical approaches from the parent discipline. So there might be some examples of transdisciplinary practice, especially I'm curious if folks know this term in the context of palliative care. But again, that's not really what I'm here to talk about today, although interesting if you're interested in learning more. Oh, and I'll note that these definitions come from an article that was written a very long time ago in 1992. So another thing to note is that these words are not new, but I think our attention to them in healthcare is growing as the years pass. Okay, so I mentioned this before, but why do we collaborate interprofessionally? There's lots of reasons. One of them is that our scientific and social challenges are increasingly complex, which I think many of us can probably relate to, and collaboration brings the most advanced knowledge and methods to address complex problems. In terms of scholarship and research, collaborative efforts have greater impact. Teams typically produce more highly cited research than individuals. And also, as I mentioned before, collaboration improves the quality of healthcare, improves symptom and psychosocial management, greater staff satisfaction, and reduced burnout, and also system effects, increased efficiency and cost reduction. That all being said, teams face a lot of challenges. Some of them were in that Institute of Medicine slide, like institutional or cultural kind of factors that get in the way. And some of these kind of speak back to those barriers on that Institute of Medicine slide, but just more specifically, some of the things that cause challenges for teams in practice, in scholarship, is a lack of common vocabulary or knowledge gaps between professions. Also big teams where there can be a burden of communication and coordination. When there are multiple teams within a center or institution and those multiple different teams have common goals. When there is, this should be a new bullet, when there's conflict around resources or recognition, geographic dispersion, task interdependence, when there's permeable boundaries and a change in composition, and I experience this a lot, like what is the team? Do I need to be in these meetings anymore? Am I necessary here? Am I a part of this team? Am I not part of this team? And then within academia specifically, but I think within the practice of healthcare also, there's an incentive and reward structure that can really be focused on individual contributions. And then a big one, I think, that's maybe less spoken about is conflict and a lack of skills to navigate through that. And what happens when we find ourselves in conflict, either a values conflict with other colleagues or a personal kind of personality conflict with other colleagues who are on our team. And when we don't have the ability, the psychological safety, the bravery, the skills to be able to navigate through that with our team members, how difficult it is to actually be a team. There's so many other challenges. If folks want to put them in the chat, things that you face, but I think these are some of the main ones that I see. Okay, so how are we doing on time? Wow, we're pretty good. Okay, so I am going to give just a little bit of a theory burst. That's just a little mini introduction to some theory that hopefully will keep your interest. And I think if you haven't been paying attention, maybe start paying attention now, because I do think this is a pretty great concept to understand. So I'm going to start with this idea of interprofessional identity formation. So, you know, each of us as professionals is trained up from those foundational years of our training, and then is trained up to have sort of a professional identity. And then that is enforced when we go out into practice and actually become the profession that we were trained to be. And our professional identity is kind of enforced by our colleagues and the roles and the skills that we have in our place in healthcare. And so this idea of interprofessional identity suggests that we need to kind of also in education and also in our practice as clinicians, be thinking about sort of this dual identity formation, one that encourages developing both a sense of belonging to one's own profession. So I have, yes, a lot of different degrees across health sciences, but I consider my home profession actually to be social work. And so I feel a strong sense of attachment and identification with the professional identity scripts of social work. But also, it's important for us as we enter onto teams to also have a sense of ourselves and understanding of ourselves as an interprofessional collaborator, as a person who has an identity as a collaborator. So that's this idea of interprofessional identity means that we kind of combine our professional identity scripts. So I'm a social worker with the important interprofessional values, beliefs, behaviors, knowledge, and skills that it takes to really be a good collaborator. And that those two things become integrated with each other. So it doesn't mean that we overrun our professional identity with an interprofessional identity, but it actually means that we sort of have these two things happening at the same time, our professional identities and also our interprofessional identities, our understandings of ourselves as good collaborators. And that's where this idea of the T-shaped professional comes in. And I think this is this just was so helpful to me when I learned about this idea. This actually comes from the field of engineering, and it's been talked about in lots of different fields. I applied it to health sciences and interprofessional education in health sciences after hearing from two of my mentors at the School of Social Work at University of Washington, Susan Kemp and Paula Narias, who are big social welfare scholars, and they write and think a lot about kind of the science of science, or the science of team science. And so they were thinking and writing about what it means to do team science, to do good team scholarship, interprofessional scholarship. And they applied this model, this T-shaped professional model, to that concept of kind of scholarship. And I think it works really beautifully to apply this idea of a T-shaped professional to the practice of healthcare also. So what this idea is that each of us has our own disciplinary grounding, which I just kind of mentioned, right? Our own disciplinary skills, knowledge, training, the role that we play on a healthcare team. And once we're trained enough to go out into the world, that could be pretty early to go out even in clinical placements. But once we get some training, we go out into these clinical placements or into our clinical practice. And this box represents whatever it needs to represent. It could be the team, it could be the clinic space, it could be the hospital that we work in, but whatever container we go out into, and we go and we are alongside all of these other professionals. And this is really what multidisciplinary collaboration kind of looks like, right? And I overlaid this image of silos, and that might have been me overdoing it a little bit, but I don't know if it was. I kind of think maybe it's okay. It's okay that these silos are here. I don't think it's overstating that oftentimes when we're in multidisciplinary spaces, we are collaborating. We're all there together. We are all there together. Everyone's there. Everyone has something to say. You can see everyone. We're all part of the team. We know that we're part of the team, but we might all be contributing in this way that is parallel. And that's not to say that that's not collaboration. It is collaboration. As I mentioned a few slides ago, it's multidisciplinary collaboration. That is a form of collaboration. But is it the best that we can do, knowing what we know now? And I think the answer is no. And so then comes this idea of becoming this developing an interprofessional identity. And so what does that mean and how do we do that? So this idea of a T-shaped professional, or as Nerais and Kemp call it, a T-shaped scholar, but I would call it maybe a T-shaped clinician for the purposes of thinking about clinical care. So this means that a person has their disciplinary grounding as a physician, an NP, a nurse, a physician assistant, a social worker, a physical therapist, whatever they identify as. That's their disciplinary grounding. And then along with that, we ought to be seeking opportunities to develop for ourselves. And if we are educators, providing opportunities for our learners to develop these meta competencies, that this crossbar of a T, that actually those meta competencies, which I'll go over in a minute, are what allow us as single disciplines to be able to meaningfully link up with each other and interact and intentionally engage with each other in a way that we're not just each contributing our perspective in a silo or in parallel to each other, but that we're doing this in a really intentionally and integrated collaborative way. And this is interdisciplinary, and also I think a model that could be used for transdisciplinary collaboration. So now we're all here, we're in our clinic, we're on our team, we're in our hospital, and we're seeing less of a silo situation and more of a connected approach in which our own disciplinary knowledge and skills is really still so foundational and so important to how care is being provided. And I want to make that really clear. This isn't about melding together everyone's skills. It's actually really about knowing the difference between the contributions that we make in healthcare spaces on teams, but also having the skills we need to be able to connect the things that we know with each other and leverage each other and lean on each other and be most efficient and most to be able to provide the most high quality care together. Okay, so what are these competencies for collaboration? So there are a couple of different places that I lean on when I'm teaching interprofessional education to think about what am I actually trying to teach. So what I'm trying to teach when I teach interprofessional education, when I bring together faculty and students and others, clinicians, to build interprofessional education curriculum, what I'm thinking about, and the reason I really wanted to share this idea of a T-shaped professional, is I'm thinking, okay, how do I help encourage the development of this kind of person? And so how is what I'm doing growing folks' meta competencies, the skills needed to collaborate? So then the next question is, well, what are those skills even? Like, what are we even trying to grow in people to help make them be able to go onto teams and act in this interconnected way? So the Interprofessional Education Collaborative, which is called IPEC, is a North American, gosh, I don't know if it includes Canada, but I think it might, although I'm not sure. Does anyone know? I'm actually not sure. It might be an American organization, but the Interprofessional Education Collaborative is a group of accrediting bodies for many different professions. I think there's upwards of nearly 20 professional training programs who are included in this collaborative. And they have brought leaders together to come and think about, what is it? What do we actually need to teach folks to be able to encourage better collaboration and practice? And they've come up with 4 domains with a whole bunch of kind of sub-competencies under each of these. So they talk about the importance of having and honing in on values and ethics for interprofessional practice, the importance of teaching, making sure people understand not only their own roles and responsibilities, but the roles and responsibilities of their colleagues, interprofessional communication skills, and then this last category of teams and teamwork, which I kind of see as like putting it all together and actually being able to enact some of these collaboration skills. Paula Nerais and Susan Kemp, again, the social work scholars that I have mentioned earlier from the University of Washington, they talk about they've kind of come up with their own list of kind of boundary standing competencies, as they call them. And they also have 4 categories that are kind of in line with IPEC and a little bit different. So they also talk about values, attitudes, and belief, but specifically the importance of kind of honing in on and encouraging folks to have a value of collaboration and a collaborative orientation. They talk about knowledge-based competencies, which I think are related to this idea of roles and responsibilities, that each person needs to have their own disciplinary grounding, their own understanding of their own roles, but also the ability and like the willingness to participate in an integrative process. They call kind of the communication skills, they call those interpersonal competencies. So they say it's important to be understood by others, to understand others and try and understand them. So if you don't understand what someone is saying, to seek out understanding of another perspective. They also talk in here about managing differences and a lot of social and relational skills that are needed. And then they add this fourth category that I think is my favorite category. I think when going back to that first question that I asked you, think about a person in your life who you might not see eye to eye with, and how do you continue to engage with them? And for me, when I think about that question, the list of kind of skills or characteristics that I maintain to be able to engage with those people often fall under this habits of mind, or what I've called ways of being category. Things like curiosity and open-mindedness, non-defensive reflectiveness, critical thinking. I've added generosity, and actually I will also add here something that I think I haven't even articulated fully, but sort of like relationship, like love for each other, for lack of better words. Like when you're on a team and it's in a professional environment, maybe you don't all love each other, but I think just having a relationship and encouraging relationship is really, and being willing to be in relationship is really important as well, because then you have that relationship. So when things get bumpy or things get hard, you have that foundation to fall back on. So I am actually finished. I guess I'm a little early, which is great. So again, if we were in person, or if there was more time, I think I would give you all some time, and I can, Amy, I'm not sure if you have the link that I sent out in the email I sent to you, but there's a Google Drive link that has kind of a big list of competencies, these boundary spanning competencies, the sub-competencies. And so I would encourage you all, we can take time for questions or discussion. I'm not sure, Amy, how you want to spend the rest of time, but I would encourage you all to take a look at the Google Doc that Amy sent. Feel free to download that, although I might need to stick a reference on if I haven't already done it. So maybe don't download it right this second, just wait a minute and I'll add a reference to it. And you can download that. I'm happy to share my slides. You are more than welcome to kind of talk about this with your teams, to engage in your own kind of team building or conversations using these materials. And then also, I think they're just important things for us to reflect on. I think that one of the things that is really important in becoming an interprofessional educator is to really take stock of our own kind of areas of strength and areas for growth when it comes to doing meaningful collaboration and working across difference. And so part of this is taking your own assessment, and part of it is thinking about, how do we teach and learn these things? What else might go on a list like the one that's provided? And and how do you think that these ideas can inform working together or inform your education in the space of IPE moving forward? That's all, I think.
Thank you so much, Tracy. We really appreciate you coming to speak with us and share your expertise with us, even though you really had no idea what the turnout was going to be. 6 people, 136 people, no big difference there.
Yeah, congratulations, it's awesome.
So I'd really like to open up the floor to people for questions. I'm just trying to figure out, because I also wasn't expecting there to be such a large group of people, and I can't see everybody on the screen.
If you go to the reactions button there, you can click raise hand, and that's probably the easiest way. If you have a question either for Tracy about interprofessional education, or for Naomi, Catherine, and I about NPPCE, that's probably the easiest way to make yourself known. Sorry, Naomi, for interrupting.
But I think if for some reason, I'm not sure if it actually gives us, like, as hosts, a little notification that there's somebody raising their hand, because on my screen there's, I guess, six different windows that I have to look through. But if we don't get to you, then please send a message in the chat as well. So who has questions? What questions do you all have? I see Chris has a question.
I don't actually have a question. I just wanted to see if the hand would work for you. So
Well, thanks for letting me know. Yeah, it gave me a little notification that says Chris Vademonker raised her hand.
Also open to folks' thoughts on NPPCE in general or feedback for us. Looks like David put a question in the chat, Naomi.
Yeah, so David says, what are the obstacles to interdisciplinary teaching and why don't we do it already? Maybe Tracy, I'll let you tackle that first, and then maybe Amy and Catherine and I can share our own thoughts about it as well.
Yeah, I mean, I think it depends. David, was that you? It depends where you're talking about obstacles in foundational education, obstacles in clinical settings. What are you thinking of? In palliative care?
David, I don't know if you want to unmute and answer the question, if you want to say, oh.
I think, yeah, David responded, formal teaching in palliative care. I mean, I don't know that I'm the best person to respond to that. I actually would put it back to Amy or one of the others to think about that. I see one person responded money. I think that's true. I think generally in clinical settings, it's not the culture for starters. It's not the way the educational system is set up, secondly. And I think those two things are both very real. And I can't speak to palliative care specifically, but I also think that a lot of what we hear is just time, and it's complicated to pull folks together. And I know with trainees who are pre-licensure trainees, you know, the way that students are in spaces is really different across professions. So medical students are rotating through and social work students are there for an entire year. And so I think that there's a lot of logistical challenges in clinical spaces, particularly with pre-licensure. I don't know about in clinical settings what folks have to say.
I think that, yeah, the logistics are certainly the biggest and obvious. I think another thing, you know, I have the distinct pleasure of leading an interprofessional certificate program where we actually get interprofessional groups of students to learn palliative care together. And I think, you know, one piece that is so incredibly important is setting up ways to have psychological safety amongst an interprofessional group. And oftentimes I feel like we skip over that part or we forget that part. And then all of our best efforts to try to get people talking together and working together and thinking about collaborations can fall apart if we haven't figured out how to set up that sort of psychological safety as the foundation.
Yeah, I see someone, I agree with that for sure. I see someone commented about now that we have moved to doing so many things virtually. I think you're right. I think that's actually a real strength for interprofessional work because of some of the logistical challenges. And I think that formats like this and breakout rooms actually are very effective for that exact kind of work where the goal is to talk with each other in small groups. Sometimes I notice in my teaching, Zoom actually is more effective sometimes than gathering in a large classroom where people actually can't hear each other, or there's not a comfortable way to turn around and sit with each other, or not everyone can see the slides, or the things that are important for any learning, but especially for interactive kind of learning around collaboration. So yeah, I agree with that.
Okay, then we have two more questions. I'm just trying to bring it up. Wow, multitasking on a small computer screen is really hard. So Peter asked, given what we know about peds palliative care, do you see an area of particularly low-hanging fruit for interdisciplinary education?
Peter, are you on? Can you unmute and tell us a little bit more about, was that question for Tracy or was that for the group, or what do you mean by that?
Yeah, sure. I guess really for the group or anyone who has wisdom along it. I was just thinking as I try to adopt some of this thinking, like I always think about what's the low-hanging fruit, what's the easiest thing, what's places where people have had good experience with this already as a place to sort of get the ball rolling.
I have one thought about that. And I think one thing to think about is that you don't have to go big. Like not everyone has to be there. So interprofessional education is when 2 or more professions learn with, from, and about each other. So I think a low-hanging fruit are there some social work trainees that you could pull into a case discussion that you wouldn't normally pull them into, or a lunchtime hour learning of some kind seminar? Like, is there some way to just get anyone outside of the main profession you're teaching into the room? I think that's a pretty low hanging fruit. And I often do that when I'm asked to go and give ethics lectures. Actually, I'm asked often at the social worker or at the hospitals around Seattle to talk to the social workers about clinical ethics. And I often say, I will do that, but can you invite someone else, any other trainee, any other group of trainees, because it's a way more interesting conversation to talk about ethics interprofessionally also.
That's such a good, easy piece of advice, just to say, yeah, I'm going to have this discussion, bring somebody else. I love that, Tracy. Other folks have examples for Peter of the way they've combined. I mean, I think our team's IDT are such, our team IDTs are such good examples of interprofessional work that as we think about the educational impacts of those, can we really bring in more professions in different ways to our IDT as sort of a low-hanging fruit?
I think we often actually undervalue, I guess, the educational value of clinical discussions and everything that, especially in the pediatric palliative care world, oftentimes these clinical discussions are interprofessional in their nature. So being really kind of proactive and thoughtful about looking at it not only as a clinical opportunity, but as a learning opportunity and as a teaching opportunity, I think to me is that really low hanging fruit in pediatric palliative care.
It's kind of like when you tell the resident or your learner, I'm about to give you feedback, and then you give them the feedback so that they know they got feedback. It's maybe you just point it out. Look, we just had a 10-minute discussion about this patient, and the chaplain, the social worker, and the nurse all contributed. You just got interdisciplinary education. Okay, that's good.
You just got interdisciplinary.
Oh yeah.
We're molding you into a T-shaped professional. And then there was one last question, and I just want to acknowledge we're probably going to go a little bit late, but please feel free to log off. We know we're all busy, and if you have other places to go, our feelings will not be hurt. So you can leave. And then we're going to figure out a best way to disseminate the PowerPoints and the recordings. That'll be, we'll determine that soon, whether we'll send out PDFs of the PowerPoints or we'll share everything on like a downloadable platform. We'll send that out to everybody. So Jody's question, I'll put you on the spot, Jody, because you're actually in the middle of my screen. Hi. So Jody asked, if interdisciplinary education works for novices in their profession who maybe don't actually have a strong grounding in their own profession. I think it's a really great question to ask. Does it work, and how does it work?
Yeah, that's a great question. I have an answer for that too. So it does work, but I think thinking about those competencies and what you're trying to teach to. So for foundational learning, the easiest and I think best thing to try and teach is roles and responsibilities. That's like an entry level. I probably should have been more explicit about that. That's an entry level conversation. Like, what's your role? What do you know about your role with this patient? And having others share what they think their role is. And that's pretty effective, even with a brand new student who's just entered into their training. I think also practicing communication skills can be done at any level of learning. I think that values and ethics get, like when we start to think about what are our professional values, that might not be something that people understand right off the bat, depending on the profession. And then obviously like practicing in teams is also like, that's the sort of the later learning outcome that comes in practice. So I think thinking about those competencies might be helpful, and then shaping your activities around those.
Actually right on time. So what other questions do people have? And you put in the chat, our next session is March 15th, where we'll be talking about engaging patients and families, mostly families, in pediatric palliative care education. And then we're also, I think, going to think through different ways of engaging everybody, since clearly there's a very, very strong interest in a large group. We'll wait for more questions, and if not, just wow, I'm floored. Thank you everyone for coming, and thank you so much, Tracy.
Thanks everyone. I'm gonna hop off. Thank you.
Thanks, Tracy. Thanks, everybody.
We'll see you in a couple months, and you'll hear from us on the listserv before then to send out some of these items.
Thank you so much for joining, everyone.
Bye, guys.
Oh, man. Really nice comments.
Great job, guys.
Thanks,
Thanks, Dan.
Thank you.
I'll see y'all soon.